the clinical sign is so obvious and so easy to recognize. That is basically jaw weakness, inability to close the mouth. What's going on, guys? Welcome in. My name is Dr. Jim Cellini, and I am a board-certified practicing veterinary neurologist. On today's video, I wanted to talk to you about some things that dogs can do that you can almost diagnose just by looking at them and seeing a symptom, whether it be a particular gait or a certain clinical sign that they're doing. I wanted to share those things with you guys today. If you don't mind, before we get started, please hitting that like and subscribe button. It helps the channel a lot. I appreciate it. Almost forgot to mention this too. If you see any of these problems, definitely see your vet. And yeah, let's get into it. So this first case example is a real patient I saw recently. The German Shepherd that I saw for an abrupt onset of basically the gait that you see here. The dog originally came into our clinic about 6 weeks prior to this for sudden onset of bruising and swelling under his right leg, if I remember correctly, kind of right leg and groin region. And they weren't able to figure out what happened to it, but nothing really otherwise happened to the dog. The dog was totally stable, and over the course of a couple of days started to improve a little bit. Swelling started to go down or stabilize, and he was discharged home. So he comes to see me because shortly after that, his right back leg started behaving in a funny way, and he started having this sort of altered gait. And the gait is, as you see right here. Notice how the hock, or kind of like the ankle equivalent of the dog, it kind of wobbles like that, as you see in the video. I'll show it in slow-mo and I'll show it in kind of regular speed. But basically, this is a certain condition that you can literally diagnose just by looking at how a dog walks. And this condition is called fibrotic myopathy. So what happens with this condition? It's basically like a hamstring tear, but in a dog. So what happens is a dog has an injury, like a torn muscle to one of their like hamstring muscles, so to speak. And that muscle gets replaced by like fibrous tissue, fibrous band that basically just replaces the muscle and creates this really tight, kind of like a rope that forms where the muscle used to be. And as a dog walks after developing this condition, their gait is altered. So what happens is as their foot advances forward, their knee is kind of pulled towards their midline, and then as their knee is pulled towards their midline, their hock gets pulled in the opposite direction, and that causes this sort of a wobble. Again, this condition is called fibrotic myopathy. Just in theory, any dog can get it, but we almost always see it in larger working breed dogs, especially German Shepherd. There really is no treatment for it. It's more of just a permanent gait change that develops, but it's not painful once the original injury heals. They can still work, they can still do their job. It doesn't cause them, long-term pain. They just have an altered gait from there on out. So yeah, that's the first one, fibrotic myopathy. All right, in condition number 2, I'm gonna show you a video of 2 dogs doing this, and I want you to tell me, before I let you know what it is this dog or both of these dogs having a seizure or not? Here's dog number 1. And here's dog number 2. Okay, do you think they're having a seizure? The answer is no, they are not having a seizure, at least as far as we know. This condition is called idiopathic head tremors. You'll notice in both videos, the dogs are kind of bobbing their head fast up and down or left and right. It can occur in both directions. And both of these dogs are responsive, they're looking around, they're alert, they're conscious, and they can be distracted out of the episode. These characteristics differentiate head tremors, idiopathic head tremors, from seizures. If a dog's having a seizure, you're not going to be able to distract them out of an episode, and very often they're not conscious and looking around and responsive during an episode. So those are the key differences. Idiopathic head tremors in dogs is a completely benign condition. It does not require any treatment. It does not require any sort of diagnostic workup. In fact, if you try to treat it with medications like seizure medications, very often you won't get any response and they won't do anything, and they'll just get side effects from the drugs. We don't know why it happens. It is more commonly seen in dogs with big heads and necks, like bulldogs and Dobermans, those types of breeds. And some people think it's an issue with the brain. Some people think it's got to do with altered, what are called stretch receptors from the neck muscles, kind of sending different, position sense signals to the brain. What I liken it to is, sometimes you catch your heel off the ground when you're sitting down, and your heel starts to do like a sewing machine type motion, something like that. I don't know if that's actually true or not, but that's kind of what I liken it to help owners be more at ease. But again, this is called idiopathic head tremors. It's benign, it does not require treatment, it does not require a diagnostic workup. And if you see your dog do this, don't be alarmed. You don't need to treat it per se, but if you want them to stop, you can either place your hand under their chin to kind of just put some support under their head, or you can just get them to move around. Just distract them, get them to move around, give them a treat, walk them outside. Just change their position, and the episodes typically resolve. All right, moving on to item number 3 on our list. All right, so I'm gonna show you 2 videos of a dog and a cat, and I'm gonna describe to you what I see and what the problem is. Here's the cat. And here's the dog. All right, so both of these pets are displaying obvious jaw weakness. They can't close their mouth. The muscles that allow you to close your mouth are called the masticatory muscles. And the nerve that innervates these muscles is the trigeminal nerves. When the nerve stops working, the jaw becomes very weak and flaccid and it kind of sags open like you see in the video. They can't close their mouth. There's only a couple of things that can cause the nerve to stop working like this on both sides. Remember, it's a bilateral sort of a problem here because it takes both sides to not work for the jaw to become this weak. So in order to cause both nerves on the left and right to stop working, you either have to inflame both of them with like a weird form of neuritis where the immune system starts attacking the nerve. An infection could maybe do it, or sometimes certain types of cancers like lymphoma can actually infiltrate both nerves on both sides and create this sort of an issue. This cat had lymphoma presenting in a very weird way. We don't see this very commonly. And in the case of the dog, this dog had what we call trigeminal neuritis, meaning just unknown cause of inflammation attacking both of the trigeminal nerves. But I wanted to include this because the clinical sign is so obvious and so easy to recognize. That is basically jaw weakness, inability to close the mouth. So it's pretty easy to spot if you do see this in your pet. And the 4th issue that I want to show you guys today is another gait example. I'm going to show you a video of a Doberman walking in a certain altered way. I'm going to tell you why this is so unique. All right, so as you saw in the video, this Doberman is walking in a very abnormal way. He's got his head down, first of all, almost like he doesn't want to raise it, doesn't want to move it. His front legs are very, what we call short and choppy, whereas his back legs are very long and lopey. There's a difference. His front legs and his back legs are behaving in 2 very different ways. So when we see this sort of a gait, we call this a 2-engine gait. The front legs are 1 engine and the back legs are another engine. They're doing 2 separate things. So how do we explain this? So a 2-engine gait is created because there's a problem in an area of the spinal cord called the cervicothoracic intumescence. It's a fancy word that just says the part of the spinal cord at the level of the shoulders. In this part of the spinal cord, if there's a lesion, say a disc herniation, a tumor, anything really, it will cause the front legs to become very short and choppy because it's directly impacting the nerves that go to those legs, whereas its effect on the back legs is more of a upper motor neuron or higher up type of a spinal cord problem, and it has more of an indirect influence. So this location is how you create a 2-engine gait in a dog. Now, if you're a Doberman or a large or giant breed dog that presents with this sort of a gait, the most common thing by a decent margin is that you have a condition called cervical spondylomyopathy or wobbler syndrome. You may have heard of this condition. Basically, this condition is an umbrella term that describes a bunch of different types of malformations of the cervical spine, mainly the vertebrae. If you want to think of the vertebrae as like train cars that are linked together by joints called the facets, if those linkages are not completely congruent and normal, over time they can develop kind of like chronic instability that leads to scar tissue formation and all sorts of like fibrous deterioration, almost like an arthritic joint if you want to think of it that way. And this arthritis of the spine, the bones and the joints, that starts to impinge upon the spinal cord and the nerves that are coming out. And this whole kind of problem is called the wobbler syndrome. So I wanted to show this because if you see your dog walking this way with the 2-engine gait, you can pretty reliably say that there is a spinal cord problem existing at the level of the shoulders. And in case you're wondering, the prognosis for wobblers is kind of all over the place. You typically treat it with medical management first, like anti-inflammatories, physical therapy. Sometimes surgery is needed, but there's no real consensus as far as what type of surgery to use. There's like 20 plus different types of surgeries recommended for the condition. So it's kind of hard to know if the prognosis is good or bad blanketly. It just kind of depends on the dog. The bottom line here is that if you see your dog walking like this, I highly recommend you go see a veterinary neurologist and get him checked out. All right, guys, so I hope you enjoyed that video. I hope you found that useful. Let me know in the comments below if you have or have seen a dog with any of these conditions, cats too. Always like to hear from you guys. Again, if you don't mind hitting the like and subscribe button, that would be great. I appreciate it, and I appreciate you watching. Thank you very much, and I'll see you next time.